Hi, I'm Jim Dover. I'm the President and Chief Executive Officer for Sparrow Health System. The first week in March, the world just turned upside down. We had this outbreak across the nation. Every state is issuing their different orders in order to try and get ahead of the disease. We did not know what was coming.
As we ramped up and realized that we would be getting cases as the cases came in from out west, we understood immediately that our biggest priority was to keep our nurses and caregivers, our physicians, well, so that we could keep our doors open to care for the community.
In January and February, you were not allowed to do a COVID test locally. The federal government had kept that at the CDC level and said, we will tell you when you have permission to test a patient. Sparrow Laboratories is one of the top 10 hospital labs in the entire nation and does over 8 million tests a year. And so consequently, we have PhD scientists on staff who actually create testing methodology. And so what happened is our laboratory started working quickly with our different partners in the scientific field, Roche and others, and started developing essentially what is considered a gold standard for COVID testing. It's called PCR. And then the demand just took off.
It started out as a tent that we put up outside of our emergency department, again, to protect our healthcare workers and to take care of the patients, protecting the other patients as well.
The feedback from our customers was, this is fabulous. And the feedback from our staff is, we're freezing. And so the incident command kicked around the idea and said, well, maybe we can set up a drive-through.
Incident command is a structure that healthcare systems use to organize in a crisis event. We all use the same structure, and it's unified through emergency management systems within the state. This is the first time that we've operated incident command for days at a time. We knew that we needed a capacity to test a lot of people safely. You really can't have a waiting room the size of the Breslin Center. And we knew the key to everything was to know who had COVID and who doesn't. So this idea came about for the old Sears. And at first we thought, how can you deliver healthcare in a car garage? But the more we thought about it, the more we decided a little paint and it would be just fine.
And so literally in a week and a half, they went from idea conception to the contractors, Granger and others, went in there. They were literally putting down a new epoxy floor over the weekend before we opened on a Monday. And I was so fearful that no one would show up. And the first day we had 200 people. And it just took off from there.
We have somewhere in the vicinity of 1,800 to 2,000 tests a day that we're running total. The community really benefits from being able to get fast access to testing. We know that we've had people here from zip codes hundreds of miles away because that's the best access that they could come up with. So we're called to care for this community, and if we can help other communities too, well, it turned out that that's what we could do.
During this time, we've actually hired more physicians. And so now we have much more primary care physicians. We have additional specialties.
I think the one thing the community had a chance to understand is this gem of a laboratory system that we have here. You couldn't spread 1,000, 2,000 people per day out. I believe the feedback from the patients has been this might be something that we want to be a permanent part of our laboratory system, absolutely.
When we started testing, we were able to do 45 tests. Today, we're able to do in excess of 3,500 tests a day. That required significant amounts of equipment as well as personnel. And yet we were able to meet that need as it came up each and every time. When swabs became a limited resource, someone said, well, why don't we consider 3D printing them? So if they become limited supply, we'll be able to meet the needs of the community right here in-house.
Right now, the community is challenged with ways of being safe. Our team, which I am very proud of, are at the front lines, holding the line so that the community is safe, that the hospital is safe, that we're taking care of our caregivers. That is our responsibility as environmental service workers. We're scrubbing and re-scrubbing surfaces, high-touch areas, so that patients, our nurses, other caregivers, and of course our environmental service team are safe. It's safe to come to Sparrow.
I think for the community to know that we're being recognized by our friends and neighbors is really important to our patients so that they have a sense of what a fantastic healthcare system, what a gem they have.
We're grateful for the Chamber, their partnership with us. We always want to be a good steward of economic resources in the community. We didn't go seeking it, but we'll readily accept it on behalf of the caregivers.
We've received national attention on that drive-through at Frandor. In the future, we're going to be here to meet the needs, whether it's COVID this year, maybe it's going to be something else the next year. And each and every time we'll step up to the plate and make sure that this community is taken care of.
It's really enhanced our level of care we do for everybody.